professor, physician, epidemiologist. I am Dr. Sri Banerjee. When the COVID-19 pandemic hit, you might have seen many of these dashboards to gather information from. Hi, I am Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'll be going briefly over comparing some sorts of local level information, but more importantly, I had already done this part in a previous video. In this video, more importantly, I'll be focusing on the process behind trying to build local level information for the whole country of the United States. So let's go ahead and get started here. What I've started doing is started by comparing what is going on in Pittsburgh in terms of mental health. So this map that I had created on a national level shows the percentage of poor mental health days in the last month. So the higher percentages are lighter purple. So let's look at a lighter purple percentage first. And what I'm going to be doing is taking a look at this bar chart. It has several measures. First one is education level, then looking at percent physical health, then mental health, percent flu vaccinations as well. This first percentage is quite high in areas where there's actually this first percentage is lower in areas with higher levels of mental health. So let's take a look at that theory. So education level is 80%, and as we would expect, poor mental health days is less than 12%, so that's why it's dark purple. Now let's look at a place where there's percentage of education is low. So poor mental health and percentage education seems to be connected here, especially if we look at in some of the counties in the Pittsburgh area. Now if we zoom out here, let's do a quick zoom out. You can quickly see some of the distributions, and then you can similarly take local level information and then assess the needs and accordingly create interventions, whether it's from a public health perspective or whether it's providing nursing or counseling services or other various disciplines. So now we can take a look at other types of information that can be represented, and specifically what I want to show you is how you can create this sort of tabular information at a local level from a map that shows all the counties in the United States. So this is about 3,003 counties in the United States, and the information being shown. So the first thing that's here is the title, and so what will show up here is the title of the county and the state. And then you have various bar charts that are available to you. So here's a bar chart which gives you now if you go further down, then you'll see various different county indicators. So you can search for any field. So let's say you want to do maybe percent children in poverty, or even percent mammography screening. So what we can do is percent mammography screening. Since that is one of the preventative sorts of activities. And then you can add that. So here we've just added the bar chart for mammography screening. And this is information for Anderson County, Kansas. So you can double click on any portion of the country and then get information similar to this. Now, how did I create all these fields at the bottom? This is not very complicated either. So you have this. So you can add new content as well, and then you can have something additional, that information for the local level. So what I'm doing is I'm adding to what is already existing, but what you would be actually doing is adding new. So then you select fields. And again, just like the other one, you can search for fields. So if you want to do mammography, and then you can again search that and then click on this and then select done, and let's see how that changes. So now not only do you have Anderson County, Kansas information in bar chart, but also the actual percentage at the bottom. So let's make sure that this works for every part of the country, or most every part. And we landed in Spalding County, Georgia, and make sure percent mammography is present, 44%. And that's what it shows here. So there you have it. You actually go through the process of not only comparing different counties and their measures to determine if there is an intervention needed, and then you can create different maps and add on different fields to gather more information about various counties. Thank you for listening.